Alright, so I am Taylor. This is my med video test out. So I'm going to walk into the room, and right away I'm just going to wash my hands, and we're going to read over the nurse's note from last night. So Mr. Wilson, James Wilson, has a high blood pressure. I see he denies having any pain or discomfort. His blood sugar is 169. So when we look on our sliding scale here, it is 2 units. And I'm going to grab a pencil. I haven't taken out any meds yet, so it's okay. Okay. Okay, so I double checked. His blood sugar is 169, and we're going to give him his flu vaccine, and he doesn't need any PRN medications because he doesn't have aching, pain, or constipation. So, again, wash my hands here. I'm double checking that all my ADM meds are in here. And it's for James Wilson, 5/12/1952. Allergies are NSAIDs. So, right away I'm going to log on to the med dispense. And I just want to say before I start the 6 rights medication, so I don't forget that, but I'll be checking it obviously throughout each med check. So we want the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. So I'm going to grab my MAR here, and we are going to type in Wilson. Okay, so Wilson James, and we want to double check the birth date, so 5/12/1952. So we want to click this one. Allergies, NSAIDs, James Wilson. Okay. So the first thing we're going to pull out here is hydrochlorothiazide. It's 50 milligrams by the mouth daily at 8 a.m. and it is non-NSAID. So let's go to hydrochlorothiazide 50 milligram tab. And he is not allergic to this. He's only allergic to NSAIDs. So 50 milligrams, that's correct. We would like one of those. So I'll click enter. All right. So that one's good. Next one, Captopril, 25 milligrams by the mouth daily, twice a day. 8 a.m. med, not allergic to it. So we will go to Captopril, 25 milligram tab, and it says drug safety. This is Captopril, good. And 25 milligrams, yes. And we only want one of those because it's 25, Captopril. One, okay. NPH insulin is 15 units of U100, so we will go to NPH vial, 100 units, compare it, okay. That is an 8 a.m. med, and he does not have an allergy to that. Also didn't have one to Captopril, I think I said that, but just to make sure. So that's yes, and U100, we need one of those. NPH, good. Okay, and then we need some regular insulin, 5 units of U100. So insulin regular right here, and that is 100. Okay, and allergies, no allergies. And regular insulin, U100, perfect. We need one of those. And that is, yes, this is right. We have the amount, 5 units I'm gonna need, plus the 2 from the regular sliding scale, so I'll be able to do that. No allergies. And then lastly, we're going to want Fluzone for the flu vaccine. So the fluticasone influenza vaccine, here we are. So 0.5 mil influenza vaccine, intramuscular once at 8 a.m. Okay, 0.5, perfect. I'll get one of those. 0.5, and enter. So it looks like I have all my medications. I have all of these. I can just double check on there. So, all right, I don't need to give any PRNs, so we're good with that. And now I can start to dispense them. All right, so the first one we have is from section C. It's hydrochlorothiazide, a 50 milligram tablet. Make sure those don't go anywhere. So, hydrochlorothiazide, 50 milligrams, 10-10-25, not expired, not allergic, comparing it to there and here, both 50 milligrams hydrochlorothiazide. So this one's good, it is an 8 a.m. med. So I'm going to put this one into the cup here, And I'm going to shut this drawer, and we're going to dispense now Captopril. All right, so we want 25 milligrams from section C. Okay, and Captopril, 25 milligrams by the mouth daily, 115/26. The expiration date's good, no allergies, and it's an 8 a.m. med. And I compared it to both here and here. So we are good on that. So this one I will also put in here. And those are all my oral medications because we have no PRNs. Make sure that's shut. Okay, next item. Insulin, 15 units of U100, the NPH insulin. So section B. Show that a little. Okay. NPH, 100U per mil, 100U, NPH, and expiration date 1/20. Not allergic to NSAIDs, so we're good. And 15 units, NPH. All right, and this is an 8 a.m. med, so that one's good. I'm just going to shut that. All right, next one that we have is regular insulin. So I'm going to click next item. Regular insulin, 100 units at 8 a.m., and that's in section A. Okay, so regular insulin, U100, U100 on here, and then it is 120 that it expires. So that looks good, and we have it for both 5 units plus the 2 units for our sliding scale. So that one's good. Gonna make sure I shut this. And the next one is the influenza vaccine. This should be our last one. So Fluzone, 0.5 mils, Fluzone, 0.5 mils, and this is from section A. So I'm gonna grab this, and it says flu vaccine, 0.5 mils, 0.5 mils. Expiration date is good, 10/10/25, and it is an 8 a.m. med with no allergies to NSAIDs. Double checking up here too, 0.5 mils, 10/10/25, and it is not an allergy to this, so we are good. And I will shut this, and that should be all of our medications we need. So I'm going to click press here, and we're going to log off for safety reasons. So on all of my medications, I double checked them against here and here. I want to make sure that I clarified the expiration date for regular insulin. It is 1/20, so it's good. Just to make sure. I know I did all the other expiration dates, compared them to allergies, and they should all be good. So those are all. We have all of that, so we're done with the med dispense machine. And now I'm going to wash my hands, and I'm going to do my second med check here. So we have hydrochlorothiazide, so that's the pill, and it looks like we have 50 milligrams, 10/10/25. It's not an NSAID, it's by the mouth for James Wilson and 8 a.m. So this one is good to go. Then, I'm just going to put these over here so I know they're done. We have Captopril, which is 25 milligrams, not allergic. It's an NSAID. It's not an NSAID. It's by the mouth twice a day. We're giving it to him at 8 a.m., 1:15/26. Good for the right patient. Always checking our 6 rights. So those are done. Then we're going to do the NPH insulin here. So we have U100 of NPH insulin, and it looks like it's 120 as the expiration date. It's an 8 a.m. med, not allergic. It's for James, so that's good. Regular insulin here. We have 100 units. Expiration date is 120, and it is not an allergy. It's an 8 a.m. med, so it's for James Wilson. Good. And the last one I'm going to double check here is Fluzone, 0.5 mils, 10/10/25, not expired, not an allergy, and it's for James. It's an 8 a.m. med too. So, have all his meds for the second med check done, and I just want to clarify that I did check these insulin. This is an insulin syringe. The expiration date was good. I'm using, so I'll use that for the insulin. And then this is the 3cc syringe. The expiration date was good, and I'm going to use that for 0.5 mils. This is my 1-inch needle for the intramuscular injection, and the filter needle to draw it up. And I double checked all the expiration dates on there. So we're gonna wash my hands again. The oral meds are done, obviously, not popping them out of the pill yet, the container yet. And we have NPH insulin first. So I'm going to first use my alcohol wipe. Well, first I'm gonna roll. So we'll roll for about 10 to 20 seconds. Something you always want to remember is to not shake these because it could create bubbles in the vial. So once we rolled for about 10 to 20 seconds, for sure 10, we want to wipe off the vial. So we are going to vigorously wipe this for 20 seconds. We want to get all around. Just to clarify, I already double checked the expiration date. It's not an allergy. About 5 seconds there. Make sure you get all around it, really clean. And I already washed my hands before preparing this, just to make sure. And 15, 16, 17, 18, 19, 20. All right, so that one's ready to go. And then I'm gonna clean off the regular insulin. And we already double checked this one against the MAR for our second med check. And we're gonna also do the same thing to this one. And we're gonna do about 20 seconds. Okay, so that one's good now. So we wiped both of them, and I'm just gonna wash my hands again because we just wanna be clean. So now I'm going to open up my insulin syringe. I double checked its insulin. So don't wanna touch it that much, so we'll grab it from the top here. And right away we can get rid of this one because we're not gonna be putting that back on. And then we'll get the plunger, we'll kind of loosen it up a little. And while we take off the top, we want to make sure we take it straight off. Okay, so that's straight off. And for the NPH, we are doing 15 units first. So I'm going to put in 15 units of air. 15, double checking with my nurse next to me that that is 15, 12, 14, 15. 10, okay. So we have the 15 of NPH. We're going to inject it into the NPH and not touch the fluid. So put it in there. It's in. Pull straight out. And then we are going to do our regular insulin, which is 5 units plus our sliding scale. He was 169, so we're in between here, and we'll give 2 units. Okay, so 5 plus 2, 7. 2, 4, 6, and go between 6 and 8, which is 7. Okay, so we have it between 6 and 8 there, which is 7, and we're gonna go into the regular insulin, and we're gonna inject the air, and then I'm gonna flip it over, and I will pull in 7 units. All right, so it's 7 units there. I'm gonna pull straight out here. We wanna make sure there are no bubbles. Looks good. We're between 6 and 8 at the 10, which is 7. So we have our regular insulin in, no bubbles there, and we're good. So we're gonna do the 7, 5 plus 2, and then we're gonna add it to 15, which makes 22. Okay, so we're gonna go into here, and we're gonna flip it over, and I'm gonna bring it to 22 units. So bring it down. You wanna go slow because we can't inject back in on insulins. So we will go right there. We we're at 22. So, a little more there. There we go. All right, I'm gonna double check. I double checked the NPH with another nurse, and we are double checking. That is 22 units there, and it has no bubbles. Double checked with another nurse, both the insulins. She watched me draw it up and double checked it. And we are going to recap the insulin because it is not used yet on a hard surface. There we go. So I'm now done with those, and we are going to label our insulin. So I'm going to do NPH insulin, and that was 15 units, double checking on the MAR, of U100, and then we are going to do regular insulin, which was the 5 plus the 2, so we're going to do 7 units total of that, and we'll put of U100, and then with that we're good. So I'm going to put the total, which is 22 units of U100, and that's together, and then I'm going to put the date to 22/19, the time 8 a.m. and my initials. Okay, so we're good on that one. Get it off here. All right, so this one's good. I already checked that it was 22 units. I can still see it here. Okay, so we'll put that on there. Make sure we don't hit the plunger or anything. And we're good with insulin. Now we're gonna clean our hands again, and we have to get the flu vaccine. So I'm gonna pop off this vial because this is not clean. Okay, and wash my hands one more time just because. And I'm gonna do an alcohol wipe here. And we're gonna do this again for about 20 seconds. Okay. 1, 2, 3. Oh, and before I do this, we'll just get rid of this one. On the directions, it says that we should shake well before administering, so I'm just gonna roll it. And I'll roll this for about 15-20 seconds here. You never want to shake it because we don't want bubbles, so we're just gonna roll it because that'll mix it up enough. Okay, so 15-20 seconds, new alcohol wipe, and just to make sure, nice and clean. And since I touched that alcohol wipe, we're just gonna get rid of that one and do a brand new one. Rip it open here, and we have that. And I already did my second med check on the MAR with this one, so this is good, not expired, no allergies. Okay, so about 20 seconds there, nice and clean, and that one's ready. So then I'm gonna wash my hands again because we touched that vial, and we are going to use the syringe. So I already double checked the expiration date on this, making sure we maintain the aseptic technique. We don't want to touch the bottom of the syringe. Next we have our filter needle. Okay, not touching that part either. And together we're gonna put these two on and pull straight off. And we're gonna get about 0.5 mils in there, according to our MAR. So, 0.5 mils of air. I already cleaned this off. And we're going to Inject it, inject that air, not touching the liquid. Okay. And now I'm going to pull out, making sure my needle's down. Always pull out more because you can push it back in. 0.5 there. Make sure there's no bubbles. Okay. Oop. Alright, so pull this out. I'm just going to make sure there's no bubbles in there. It's still at 0.5. Looks like it is a little. I need a little more just because I want to make sure it's directly there. All right, now we're at 0.5. I just want to make sure we have the correct dosage there. And there is no bubbles in there. It's at 0.5. Okay, and now we're going to put the filter needle back in without touching it. Do it against this hard surface here. Okay. And we have that. So maintain that aseptic technique. And we're not going to put it in the trash. We're going to put it into the sharps. So next we're going to take this off the 1-inch needle. And we're not going to touch in there. Okay. So we're good on there. Just making sure there's no bubbles. Looks good. Okay, and then I'm going to label it. So make sure that's there. Yep. Oh, okay, sorry. I need to disregard this, and I am still in here. I'm keeping my eye on my medications. Filter needle. I'm watching them. We're good. And I have this. So my flu vaccine should still be good. I'm going to just make sure that it's cleaned off here. All right. Again, about 20 seconds. Okay, so 20 seconds, good. And we are going to wash our hands again. And I'm gonna drop one more time. I've already made sure this expiration date is good too on the box. It is a 3 cc syringe. Okay, not touching the end of the syringe. Filter needle, not touching. Keep that aseptic technique. All right, loosen it up. Okay, pull straight off. And we're gonna inject 0.5 mils like our MAR says. Okay, it's in there. Make sure of that. And this time I wanna make sure that I get that 0.5 mils exactly. All right. Okay, so I'll get out the bubbles now, and just to double check, it is at 0.5, and I'm gonna get out these bubbles here. All right, so the bubbles are out at 0.5, and I am going to use that filter needle cap, wherever I put it here. Looks like, trying to find it here. Okay, so we will have it, we'll put this one right here. Okay, so with this, we are going to put it in. Okay, keep that aseptic technique. Want to get rid of this needle right away, and keep the aseptic technique. Do not touch your syringe to your skin. It got a little close there, but we're making sure. Pull this back. This is still sterile. And we're gonna screw that on. Looks good. Still at 0.5. That's better. So, no break in the aseptic technique there. These are good, and I'm going to label now. So that was flu zone, 0.5 mils. Okay, 0.5 mils, and it is 2/22/19, 8 a.m. and TF. So we are good with that. I will put it on here, and 0.5, no bubbles. 0.5, 0.5, looks good. So labels, 0.5, got that, and we should be ready to go to the patient's room. All right, so wash my hands here. Bring my med cards, medications, and this. All right, so first thing I'm gonna do is I'm gonna knock on the door. I'm gonna come in, introduce myself. Hi, my name is Taylor. I'll be your nurse today. Wash my hands. I'm gonna come up to the patient, make sure I know their name, date of birth. Wanna make sure that I have my MAR with me. Okay. All right, so you're James Wilson. Can you please state your name and date of birth? James Wilson, 5/12/1952, and your only allergy is NSAIDs, is that correct? Okay, sounds good. And now I'm going to complete my third med check before I explain to him everything we're doing. And from the looks of it, the patient looks safe right now, which is good. So, we are going to first check the oral medications. We have hydrochlorothiazide, 50 milligrams by the mouth daily, 10-10-25, not allergic to NSAIDs, and it's the right patient. So, before I would have done that, I would have made sure that my hands are clean, which I had done. And we're gonna put on some gloves here, because I don't want to break aseptic technique when taking those pills out. So, put these on here. All right, so I'm just gonna redo this one just so it's clean. So hydrochlorothiazide, 50 milligrams, 10-10-25, no allergies. It's an 8 a.m. for James. So I pretend to pop that in there. But for the purposes of this video, we don't want to waste meds, so I have it there. And then I am going to do my other oral med, which is Captopril, 25 milligrams by the mouth twice a day, 1/15/26, good expiration date. It's not an NSAID, 8 a.m. med. Pop this one in here. And I would ask him, do you want to take all your medications together individually? And you'd say individually. And before I would administer them to him, I'm just going to tell him, I can explain a little bit about these just so you feel comfortable with them. So, first one is hydrochlorothiazide, which is also called hydrochloral. That might be something you see in the stores. So you'll take it by the mouth. You're not allergic to it. But before I administer it, these are both hypertension medications, and he had high blood pressure, so I can give it to him. So for this drug, I'm giving it to you for your high blood pressure. Some of the side effects you might see is increased urine output, so don't be scared about that. Orthostatic hypotension, so if you have if you kind of get up too quickly, you might see little spots in there or get dizzy or faint. So just let us know when you want to get up. You might have a headache or an upset stomach. And then we have Captopril, which is also called Captopin. And this drug is also an oral medication. And before I administered it, I'm going to make sure the blood pressure and that was good in the report. So I'm going to give it because he's hypertensive. And this drug is for high blood pressure, hypertension, and will continue to monitor your blood pressure throughout the day. So some of the common side effects include a rash, your skin might itch, your taste might be a little bit decreased, and some rare side effects are headache, cough, dizziness. So that one should be good, these two. And I'm not touching the pills, but I'll just wash my hands. We'll make sure he's sitting up here at least a 90 degree, just so he doesn't choke. Okay, wash again. All right, James, I'll give you some water with this and just swallow these down for me, okay? And as I give it to him, I'll just explain some of the things you can do to get down your blood pressure is maybe try to exercise about 30 minutes a day. Give him his water. Okay, so these have been administered. I did my third med check on the MAR. Okay, next, James, we are going to give you your insulin. So we're going to double check this against the MAR. Just double check here. So we have NPH insulin 15 units and regular insulin 7 units because we're doing the 5 plus the 2 at 8 a.m. So that one is good. We're going to double check the actual vials here. So NPH 15 units of 100U, expiration date 120, good. No allergies, good. And we have regular insulin, 100U, and 120, and it's not an NSAID, so you're good. So the insulins are checked, and he should be good to go on those. First, I'm going to bring his bed down. Okay, James, so basically what we're going to do is I'm going to explain this insulin to you quick. We're just going to put it into your right lower sub-Q because you had your last one in your other sub-Q, your left. So, all right, so this medication is insulin. It's a mix of both intermediate and regular. We normally give this about 30 minutes before meals, and what I needed to do is check your blood sugar levels, which we're going to regulate them. It said in your report. So we're going to get it under control. Basically, it's going to balance out those blood sugar levels, and the common side effects are redness, swelling, or itching around the injection site, and we'll also monitor your blood sugar levels throughout the day. So something with this, we want you to eat in about 30 minutes because that's when it'll be most effective. All right, grab some gloves here. All right, James, I'm going to uncover you here. And I already did my double check against this. I washed my hands, put on my gloves, and I double checked it against the MAR with this. The total was 22 units. I had another nurse check, so we're good. All right, James, I'm going to move this over here and just expose a little bit. And we're going to go 2 inches away from the umbilicus and start washing here. And there's no redness or swelling, so we're good to give it there. So for the purpose of this test out, I'm going to do it on the injection pad. All right, so we want to wash for about 15 to 20 seconds, in to out. All right, so about 20 there. I'm gonna go out 2 centimeters. Let that air dry, and I already did all my med checks with the insulin. So I'm going to pull this straight off. I can dispose of that now. Still 22, and let it air dry. And I'm just gonna say, James, you might feel a little pinch, but it shouldn't hurt too bad, okay? So we're gonna grab twice the needle size. And since James has enough sub cue to grab, we are going to grab and put at a 90-degree angle. All right, James? So I'm going to stabilize, inject it slowly, and we're going to hold it there for about 10 seconds. Okay. And I'm going to stabilize the skin and pull it straight out. Put that away right away. And I'm going to give James a gauze pad just to put a little bit of pressure on there so it's not bleeding. Okay, and it looks like he's not bleeding. So we're good with that. I'm going to dispose of these gloves and wash my hands again. All right, James, we're going to sit you up and I'm going to give you your flu vaccine. And I'll tell you a little bit about that too, okay? All right. Just going to expose a little bit of your arm here. I'm going to bring down the side rail just so I can have a little more access. And I'm watching him, he's okay. And now we are going to do our third med check with the flu. So I'm going to grab some gloves here. All right, James. So the last one, I'm going to pretend like I'm not touching this. So I wouldn't touch this and then I'll just redo it so we're good. Okay, so the next medication is Fluzone, which is also the influenza vaccine. It's the flu shot. We're going to give this in your arm. It's called your deltoid muscle. This vaccine should protect you against the flu, not 100%, but it lessens your chances of getting it. So some of the side effects you might feel is some pain in your arm, some redness or swelling, and maybe even a low fever. So we'll watch for those. All right, so I explained to him all my medications and stuffs were good. And now I can look, well, we're not going to do that yet. We'll double check this against here. So Fluzone, 0.5 mils, 0.5 mils, 8 a.m., not allergic. And same with this. We have 0.5 mils, 0.5 mils, 10, 10, 25, not expired, not an NSAID. And yes, we're good, it's a flu vaccine. So first I'm going to do is I'm going to clean off, I'm going to find his acromion process. So found his acromion, and we'll go 2 fingers down, and that's where we'll give it. So for the purposes of this video, I'll do it on the injection pad again. All right, so we're going to clean this off for about 10 to 15 seconds. Just to make sure it's nice and clean. And go about 2 centimeters out there. Let that air dry. And for this, I have the 0.5, 0.5, one more check there. I already did my third med check, and I'm just going to explain to James this might pinch, sting a little bit. Disregarded it. And we're letting that air dry there. And we're going to grab twice the needle length and go in at a 90-degree angle. So it's air dry, so we're going to go twice the needle. And we're going to go 90 degrees. And I'm going to stop and stabilize, aspirate. Okay, beautiful. And now I'm going to inject slowly 1 ml per 10 seconds. Okay, and now I'm going to hold it here for 10 seconds, like I held the insulin for 10 seconds. Okay, James, I'm going to stabilize the skin, pull it straight out, and I'm not going to put this with my finger. We're going to put it against here, snap it, put it right in the safety, and I'm going to give James some gauze here on his arm just to make sure that he's not bleeding. Put some slight pressure on there. So both my injections I went in at 90 just to make sure. Grabbed twice the needle, cleaned it, let it air dry, and gauze at the end. And it looks like he's not bleeding, so we're good. Dispose of that. Bring these down here. I did all my med checks, and we gave him all his meds, explained to him, and I'll just make sure this is down here for you. And I'm gonna bring back up this side rail just to make sure, safety reasons. Are you comfortable like that? Okay, here's your call light. Safety rails are up. Your bed is locked and low. So I'll be back in about 15 to 20 minutes to check on, or 15 to 30 to check on you, okay? Let me know if you need anything with any side effects you might be feeling or anything you're concerned about. So once I'm done explaining to James, checking his safety, I did all my K-wipes, and I'm gonna wash my hands again. And now we are going to document. So I have all my medications still with me in my eyesight. And what we're gonna do is say the date. So it's 2/22/19, 2/22/19, 2/22/19, 2/22/19, 2/22/19, 2/22/19. All right, and we're gonna say that we gave this at 8 a.m. for each of these. Oops. So this was an error right here. I accidentally put it in 1800, so I'm crossing that out, not scribbling. So we're gonna put 2/22/19, 8 a.m. And by my error, I'll just put TF just so they know that was me. And then we're gonna put 8 a.m., 8 a.m., 8 a.m. And this one we're not concerned about because it's not an 8 a.m. And then next we're gonna do the dose I gave him, which was 50 milligrams. And I'm gonna say by the mouth, and then that was it. So I'm gonna put TF. And then we're going to say for this one, 25 milligrams. And that was also by the mouth in TF. And then we are going to do NPH. I'm gonna say I gave him 15 units of U100 and gave that in his right lower abdomen. TF. And then same thing with this one except for we're gonna do, we did 5 units of regular plus the 2, so it was 7 units total. So we will do 5 units of this regular U100 and then right lower abdomen. TF. Okay, and then this one we did 2 units of the sliding scale. U100 regular insulin. And right lower abdomen. TF. Okay? And then lastly, we gave 0.5 mils of Fluzone in right deltoid. Okay? And that was intramuscular. TF. I will initial, signature. Well, Rocky, you can look at my MAR. Make sure I did everything right. Got it all filled out. And I should be good. Because we had no PRNs, so just to say.